Hi, I'm Dr. Bart. I help folks obtain their personal fitness goals. I work with the entire range, the entire gamut of folks that are trying to lose weight, so weight loss is their number one goal, through people that are maybe trying to get back to the gym, maybe they haven't worked out in a number of years, through people that are having very specific fitness goals, all the way through bodybuilders. So I work with the entire gamut of people to obtain their fitness goals. You know, one of my folks, an interesting comment, if I don't run like a rabbit and eat like a bunny, I put on weight. And she was incredibly frustrated and went on to express that, it goes beyond frustration, confusion, and how actually depressing it got for her. And that really hit home. And I'm sure if you're watching this video, you've probably felt that too, that depression, that frustration. It's a very, very difficult process to go to, and certainly takes its toll on people mentally. And I should that the NIH has a recent publication where that over 60 million Americans are overweight. 60 million Americans. So we certainly have a tremendous amount of company, and certainly not alone if that's a challenge for you. Now, my individuals that I work with is a bodybuilder. He came to me the other day and said, I'm just not putting on the mass that I want. I've got a couple body parts that are lagging. I'm not building those up the way that I'd like to. And, what supplement should I be taking? What's the real key? And that brings us to another great point. We're all barraged every day with diets, everything from the South Beach diet to calorie counting to Weight Watchers, Nutrisystem, Atkins. We're barraged with diet plans as well as exercise videos. We've all seen those, abs of steel to everything else. And supplements. Take this pill. It'll help you lose all the weight you want. Take that powder. That will help you lose all the weight that you want. And which one's really the right answer? Well, let's circle back to that in just a minute. Let me give you a little bit of my personal background. I'm a physician. I've been in private practice over 24 years now. And I've been in the gym working out over 38 years. So I've actually combined the education, the years in private practice, and my experience in the gym to develop what I call the 5 critical keys to weight loss and obtaining your personal fitness goals. Now, in addition to that, you may say, well, what are these 5 keys? And 2 of them very easily, diet and exercise. We hear about those all the time. But it's the other 3 keys that frequently people miss that can cause tremendous deficits, problems, issues with obtaining your personal fitness goals. So really, as we look around, we see everybody offering you a piece, but no one has really packaged it and put this whole weight loss and obtaining your fitness goals into a concise, ordered approach that allows us to methodically help every individual. Because the real answer, there is no one best pill, because we're all individualized. The answer is different for each person. But by using the 5 critical keys in this methodical approach, we determine what's the diagnosis, what's most appropriate for you as an individual, and then we use the team approach for implementation. We use the team that's going to help you implement. It's one thing to know, here's my problem, here's what I need to focus on. It's another thing to actually go out and implement those things correctly. And that's where my team approach helps people to obtain those fitness goals as well. So now, let's delve in just a little bit deeper with these 5 critical keys and the team approach. Show you how the Dr. Bart team approach can provide the most in-depth, comprehensive, and scientifically sophisticated method to help you obtain your personal fitness goals. So, let me start by giving you a little bit of my personal background. Unfortunately, I had a weight problem as a kid. I had a weight problem from as far back as I can remember, and it was something that as a kid I just battled endlessly. Also, unfortunately, I was one of the recipients of the way kids can tease each other, torment, ridicule, embarrass. I experienced all those things firsthand, so I am extremely familiar with that whole scenario and what can do mentally and psychologically to a person to have that kind of ridicule. Now, fortunately for me, when I was in about junior high, it was about the same time that Sylvester Stallone was doing the Rocky movies, Lou Ferrigno, The Incredible Hulk, Arnold starting all of his action movies. And I looked at those guys as a role model. I saw them and said, yep, those are the guys that I want to look like. So between combining the ridicule and the embarrassment that I felt as a kid and looking at these guys, Stallone, Schwarzenegger, as role models, I began and adopted a total lifestyle change. I began hitting the gym, I worked out, and fortunately for me, it really was a complete lifestyle change that now 37 years later, I'm still working out, I'm still hitting the gym. So it was really a complete lifestyle change that these guys helped me to facilitate. Now, for my education, I'm a physician. I'm a residency trained foot and ankle surgeon. I've been in private practice for over 24 years now. So I have extensive knowledge of anatomy, physiology, surgery, biomechanics, and I've combined this with my 37 years of working out in the gyms. So this combination of 24 years in private practice and 37 years practical application in the gym allows me to have one of the most well-rounded knowledge sets of almost anyone out there. And this is how I'm going to help you obtain your personal fitness goals. Now, this combination of knowledge and experience is how I've uniquely put together the offering of the Dr. Bart team approach to helping you obtain your fitness goals. Now, at a high level, who's involved in this team? What are we talking about? When you join and you're a member, we'll get into this in great detail. But for this discussion, we'll stay fairly high level, and we'll start typically with what I recommend as a healthcare provider myself, a good physical exam. Particularly if you're a novice or someone who's been off for a while, you haven't hit that gym or you haven't been in a workout program for a while, we always recommend get your primary care doctor, get a good physical exam and workup. Let's make sure that there's no underlying physical conditions or disabilities, problems that we need to address, no high blood pressure, diabetes, anything like that. And let's make sure we get what we call medical clearance so we know you're in good shape to proceed on with your fitness goals. The next people that we'll talk to, or the next group, is going to be nutrition. Now, diet and nutrition, as we all know, is really the key. It's one of the primary factors that are going to be involved in weight loss. Diet is everything. And this is where we get you counseling from either a dietitian or a nutritionist, someone who's going to help you tailor your diet so it's specifically working for you. There's a number of different diets out there. Everybody's heard of them, everything from low-cal to Atkins and everything in between, Nutrisystem. But what we're really going to do is use the nutritionists and the dietitians to determine what's the most effective plan for you. Next, people will consult with, it's going to be obviously getting you that exercise that you need, and it's going to be finding you the appropriate gym. Maybe it's a fitness facility, maybe it's fitness classes. Whatever we determine is going to best meet your particular fitness goals, we'll help you find the best area, the best gym, the best in your particular area that will help you attain those goals. After that, we'll hook you up with trainers. Now, personal trainers are excellent because they can help you with the specifics of the exercise that's going to benefit you the most, and again, help you obtain those goals, watching form, technique, explaining, particularly if the novice. Trainers are invaluable, but also invaluable even for the intermediate and the advanced trainer. So these personal trainers are the people who are going to help us at the next phase to obtain those fitness goals. After that, we'll swing back and we'll revisit the nutritionist. After you've worked out for a while, we're going to reevaluate and see, are we really hitting those goals? Are we really on target? Are we getting you what you personally set as your objectives? Are we on target? This is where we may need to add additional supplementation. We'll get into that in more details as well. Now, after we've trained for probably 2 to 3 years, there may be some things that we just haven't obtained yet. And this is where we may need to consider surgical intervention. Now, surgical intervention will be things from possibly fat reduction. We use cryotherapy today. We've got the lap band. We've got bariatric procedures, liposuction. We've got a number of different procedures that can help us with that fat reduction if we deem that's appropriate for you. For the more advanced trainers, sometimes we say, hey, you know, my body's just not responding. I'm not getting what I need. That's where we have the advanced application of biomechanics and kinesiology to evaluate perhaps tenotomies, perhaps tendon movement, perhaps even some bone resection. These are all much more advanced and only for the person who really needs these if good basic fitness training, diet, and nutrition have not gotten them to the point where they're hitting their personal fitness goals. So attention to the multitude of details is really what makes the Dr. Bart team approach unique. We have all the things that we've talked about and more available to you on video. So we've got an extensive video library for you to review whenever it's convenient for you. We also will have access to our counselors and all of the advisors that we're talking about, but these are for members only. Now, access to the unique Dr. Bart team can and will change your life. Absolutely, we will help you obtain your fitness goals. We all have to be people of action. The real question, are you obtaining your personal fitness goals? Are you where you need to be in your life? The Dr. Bart team is here to help. Ready? Give us a call. Let's get started today.